Hey, my name is Ailish. If you would like to see more birth stories, visit our YouTube channel, Journey of Parenting Portugal.
Immediately the nurse took him, and when I was expecting that they would approach, matter of 1 second, they left. By that time I was just screaming, my son, I want to hold my son, and they were, no, calm down, he's fine. I am Luciane. I moved to Portugal from France in 2018 and I got pregnant in 2023. I was 43 years old. I'm now 45. Since I got pregnant already after the 40s, it was a big experience for me because it was my first pregnancy ever. So everything was really expected and scheduled and everything in my mind. During the first 3 months, I experienced 3 bleedings, being the last one considered an hemorrhage. I went to Faro hospital. I experienced and I've learned that until you are 3 months pregnant, if you are bleeding and you have an hemorrhage, it's your first pregnancy, of course you kind of freak out. You freak out. There is not the emotional support that was not really taken into consideration. I was also followed with my pregnancy in the what we call Centro de Saúde, and this I have no complaints. The nurses were always very attentive, and the family doctor as well. I was in the doubt in between the private hospital or the public one. I decided to go through the public one first because it was a risky pregnancy. So we decided, and the doctors, that it would be a scheduled C-section. So I would know the date and everything. The doctor team will be waiting for me and things will go smooth. I would not need to worry about the surprises. I also got informed through a friend that we have the right of having a birth plan. So I downloaded online, I filled it up. I was really attentive to give to the right person once I arrived. I wanted to highlight was the fact that my husband would be with me in the room, in the surgery room, and the skin to skin would be done. I knew the importance for the baby and for myself. And 10 minutes before I leave to the C-section, the nurse, when I asked about how it would be, but what moment you're going to put the baby with me, and she informed that would not be possible because the room is not prepared and the room is very cold. That was quite shocking for me, not being able to hold your baby or even to feel your baby on you. It's quite hard, especially when you learn that 10 minutes before. Very fast, I briefed my husband how he would do it, the skin to skin. By that time, I was really scared and anxious, and my body was shaking a lot. Maybe my stress level was very high, or maybe the temperature indeed was quite cold in the room. And the anesthetist was even find it a bit hard to position the needle because I was shaking a lot. I calmed down slowly. The C-section started and they just told me he's here, he's well and he's with us. Immediately the nurse took him, and when I was expecting that they would approach, they just, in a 2 meters distance, they just put it in matter of 1 second, they left. By that time I was just screaming, my son, I want to hold my son, and they were, no, calm down, he's fine. Immediately I started noticing, some different looks with the doctors. They were instructing the anesthetist to put something on the veins, and which I didn't know what it was. When finally they finished, I went to the room. My husband was there doing the skin to skin with the baby. By that time the shaking was very, very strong. I was just feeling this very intense cold. They started putting the machines heat up, and by the time I was already with 39 Celsius fever. They were trying to contact the anesthetist, which was already out of the hospital, and I just thought that I wouldn't make it, that I was going to die. I couldn't even hold the baby or even put him because I was really jumping from the bed, crying and not knowing what was happening, and that fear of dying. And of course the nurses were there doing what they could. I didn't really got an explanation, or any doctor came to see me and say, like, don't worry, this is fine. While these things were happening, the nurse came and said to me that the baby was hungry and he needed to be fed. And since I couldn't do it, if they were allowed to get with the formula, with the bottle. So of course, in such a circumstance, you don't really question in your head. I was just, okay, if he's hungry, you don't want your child to go through it, so I authorized, without really considering and thinking about that. Once the baby is born, he still has at least few hours that he can resist without having immediately formula. Finally went to the room. When I got into the room, immediately Eros took the breast, and it happened well. Like, we could see that he was sucking and things were going, but still, as he was falling asleep, and considering that I had diabetes during my pregnancy, they said that he may experience hypoglycemia because he was sleeping a lot, that I should get with the formula to not let the baby starve. I think we could try to find other ways. Unfortunately, here in Portugal, we don't have, I don't know how to say it, but the banco de leite materno. By that time, I started experiencing this very strong pain here, very intense, like two swords inside. I didn't know what it was, and the pain of the cut was nothing compared to that pain I was experiencing. The nurses came to press, they actually press the cut to make the excess of blood come out, which is quite painful, but still that pain was just getting in here and very intense, and nobody could make me understand what was going on. And you cannot have someone to stay with you during the night, even when you go through a C-section. Experiencing all that pain, I still, of course, was with the baby, so to change and breastfeed and be with him. Pain was really intense. Around 1 o'clock in the morning, I was believing again that I wasn't gonna make it, especially because nobody could explain to me why this pain was intense and why it exists. They took me to make some exams. They don't have a nursery in the maternity, so if you need to leave the baby to go to make exams, the baby stays in nurse's room where they rest, and also their office. When you come back, you just take the baby. It was quite full, the maternity, even the bracelets that they normally have, security bracelets, it was run out. Besides of all I was going through, I had this concern that, okay, the baby's gonna be left there alone. Of course, he wasn't alone. The nurses were really nice with the baby and with me, but you don't really understand what's going on. Finally, they didn't see anything on the exam, so I was the whole night experiencing this pain. And in the morning, when you have the visit from the doctors, luckily that day, the doctor that passed to make the visit, she recognized me. She took out the mask, and on that time we were still wearing masks. That was 2023. Asked me if I recognized her. So it was the doctor that was part of the team, the doctor team that was operating me. And I told her, please tell me what happened. And you bleed quite a lot. We were struggling, trying to make you stop bleeding. Your uterus was not contracting. So we exposed your uterus to help the bleeding to pass, and we were struggling to put it back because it was not contracting. That's why we had to put oxytocin to make it contract. On this over manipulation, maybe a lot of air came in, and this pain that you had, it's very rare, and I know what you're talking about because I had this she had that on her birth. And that's because of the air. So luckily she was there. The only information that I learned what happened on my birth. I had other complications, like because of the fever and maybe the stress. And luckily I insisted not to let be influenced about, okay, we can give formula as if it's something normal, when we could maybe insist and believe in the power of the mother's milk and the breastfeeding. I did experience the baby blues because I was in quite of a dark place. I was really scared that I would die or something would happen to me, and the baby would be left, and I didn't want to stay alone with the baby because I thought that something would happen. And luckily enough, I had the support of my husband and my mother that was with me. But what I really missed was to have a professional support as well, which doesn't really exist. You just give birth and you don't see any doctor afterwards. You don't have a follow-up on the first week or someone you can talk to. Yes, everything is really related to the baby. So of course you have the follow-ups for the baby and the first vaccines and all, but for the mother, if it wasn't me to have a strong network and friends that were supporting me and holding my hand and said everything is going to be all right and what you've experienced is past, and to understand what really happened, I think this would have made a difference since the beginning, to know what was going on. And I hope my testimonial made things, even if it's a little better on this aspect, and to avoid other mothers to go through what I've experienced. I'm very grateful for the baby I have. He's a very healthy baby. We are still with the breastfeeding, so we kind of made it. And yeah, I hope things get better on this aspect.